Hello guys, welcome and welcome to Meteor Nursing Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS, NCLEX and OIT training. Today in this session we are going to discuss most important question related to fundamental of nursing which is already asked in the previous year NORCET examinations. So let's discuss in detail about these questions. So let's begin the session. So the first question is, you are noticed that the patient IV site is cool, pale and swollen and the solution is not at all infusing. Which if the following problem you will document in the report. So here the keywords are the IV site is cool, pale and swollen and solution is not infusing. This is the keyword. So if you are coming across the word cool, pale, swollen, especially the word cool in the IV site, if you are touching the IV site, you are feeling coolness. So immediately you have to think about what? Option B, that is infiltration. So here the right answer is infiltration. So what are all the other options they have given here? Phlebitis, extravasation, hypersensitivity. So these are all the other options. So let's discuss the rationale about each and every options. So the first one is phlebitis. What is phlebitis? Inflammation of the vein. That is called as what? Phlebitis. So in phlebitis, the most common manifestations are redness along the path of the vein. Along the path of the vein, that is the keyword. Okay, so redness will be there, erythema will be there along the path of the vein. Apart from that, puffy area will be there over the vein and warmthness will be there. Warm feeling will be there. Whereas in infiltration, what I have said, coolness will be there. Whereas here, warmth will be there. And the next one is infiltration. The classical manifestations are swelling, discomfort, burning sensation, tightness will be there, and very important keyword, coolness and blanching. Okay, and if you are trying to infuse the fluid infusion will not be there. Okay, so these are all the classical manifestations of infiltration. Here in this image you can see very clearly, this is the vein and this is the tissue. Okay, so these are all the tissues. So here there is a counter puncture in the sense the IV cannula is piercing the blood vessels and it is reaching the tissue, and once you are infusing the fluid is accumulating around the veins, not in the veins. The fluid is not moving in the veins because you can see the cannula, it is moving out of the vein and it is present over the tissues. So whatever the fluid you are infusing, it is going to be accumulate in the tissues. Okay, so this condition is called as what? Infiltration. Okay, and mostly there will be a confusion for many students, the difference between the infiltration and extravasation. See, the mechanism is going to be same for infiltration and extravasation. In infiltration, you are inserting the needle and the needle is puncturing the vein and it is entering into the tissues, right? And if you are infusing any fluids, it is going to accumulate in the tissues. Okay, so the same mechanism is going to happen in extravasation also, but if you are administering the harmful fluids, for example if you take potassium, calcium, if you are infusing this kind of fluid, it will cause tissue damage. Because of what? Extravasation, tissue damage. Because of counter puncturing of the blood vessels, tissue damage will be there. If the tissue damage is present, then it is called as what? Extravasation. If you are infusing a normal saline after the counter puncture of the vein, if you are infusing the normal saline, so the normal saline will not cause any kind of necrosis to the tissues. Okay, so in that condition it is called as what? Infiltration. So here you can see in the definition, infiltration means not harming the tissues, only swelling will be present. The example of fluid what you can infuse is normal saline. While you are infusing the normal saline, there is no harm to the tissues, but still the coolness will be there. And extravasation means you are infusing the fluids like or medications like calcium gluconate, potassium, it is going to harm the surrounding tissues and causing necrosis of the tissues. Okay, so this is the basic difference between the infiltration and extravasation, the main difference guys. Okay, apart from that, the complication of this infiltration and extravasation, what is the complication? See, the main complication is the compartment syndrome. Okay, see, whenever you come across the word compartment syndrome, that is the swelling of the muscles, the swelling of the tissues, it is going to compress the blood vessels. Okay, so in compartment syndrome you have to think about what? 5 P's: pain, pallor, paralysis, paresthesia and pulse. Okay, so this is the classical signs what you supposed to check during the compartment syndrome. Okay, so this is all about the first question, and let's move on to the second question. Which of the following IV cannula is correctly matched? This question is also already asked in the competitive examination. Here they have given the 4 options, and here the rightly matched option is option B, that is 26 gauge IV cannula. It is in purple color. Okay, 26 gauge IV cannula, it will be in purple color. Most commonly, which cannula is used in the hospital settings, especially in the emergency? 18 gauge. 18 gauge, it will be in green color. 18 gauge will be in what? Green color. If you are taking 20 gauge will be in pink color. If you are taking violet color, means it will be in 26, violet or purple. Okay, fine. So related to that, you can see here it is starting from orange, that is the color code starting from orange. Orange means the gauge size is 14 gauge, gray means 16, green means 18, pink 20, blue 22, yellow 24, violet 26 gauge. And here also I have mentioned the flow rate. Okay, so please memorize these flow rates. Okay, so this is the memory based point of view. Okay, fine. So by means of keeping these color codes only, we have selected the correct answer, that is purple means 26 gauge IV cannula. Okay, so here which is the right answer? Option B. Next question is, the patient is receiving the transfusion of packed RBC, and which of the IV fluid you should keep at the bedside? So in a single reading, you are supposed to understand the concept of the question. So here which is the keyword? The patient is receiving the transfusion of packed RBC. This is the keyword. So the patient is undergoing what? Transfusion of packed RBC. So which fluid you supposed to keep in the bedside? So here they have given 4 options, that is normal saline, 0.9% of normal saline, 0.4% normal saline, Ringer lactate, and both A and C. And here I have selected option A, that is 0.9% normal saline. It is a isotonic solution. Even oral is also an isotonic solution, but still I am selecting only option A. Okay, so why I am selecting this one? Let's see in this detail. So compatible fluids and incompatible fluids. Okay, so incompatible fluids is the heading I have given here. So what are all the incompatible fluids? The first one is hypertonic and hypotonic solutions. Okay, so whenever you are infusing the blood, suddenly the patient is getting any kind of allergic reactions, immediately the first priority management what we supposed to do is you have to stop the infusion. After stopping the infusion, what we supposed to do? We need to keep the line IV cannula patent. How you will keep the IV cannula patent? You have to start the fluids. What kind of fluids we need to start? Isotonic solution we need to start. So which isotonic solution we need to start? Normal saline or Ringer lactate? We need to start 0.9% of normal saline. We should not start the Ringer lactate, because the Ringer lactate solution contains calcium. Okay, and the packed RBC, it contains what? Citrate as an anticoagulant. So calcium plus citrate together, it will form what? Clotting. So we should not start Ringer lactate. Okay, so what we supposed to start? The best solution is 0.9% of sodium chloride. And also we should not start or go with hypertonic or hypotonic solution. Why we should not go? These solutions will cause what? Hemolysis. Even the dextrose, it will also cause what? Hemolysis. So all these are incompatible fluids. What are all incompatible fluid? The first one is Ringer lactate. Second one, hypertonic solution. And third one, dextrose. The compatible fluid is only 0.9% of sodium chloride. Okay, and the next one is, what are all the content present in normal saline and Ringer lactate? So here you can see here. See here, 2 questions there are possibilities. That is, usually they will be asking the osmolarity of the solutions. Okay, and also they can ask about the content present in each isotonic solutions. Let's see in detail. See, normal saline, it is a isotonic solution, and the osmolarity is 308 milliosmoles per liter. Okay, see what is osmolarity? See, here we are going to measure the amount of particle which is present in the solution. Okay, how you will measure? You will be measuring in volume. Okay, you will be measuring in volume. If they are asking osmolarity, osmolarity means you are going to measure the concentration in kg, whereas here they have mentioned osmolarity. Rity means you are going to measure the volume. Okay, fine. So here the normal saline osmolarity is 308 milliosmoles. That is amount of particles present in the fluid is together 308 milliosmoles per liter. How I got this 308 milliosmoles? Here you can see sodium 154 milli equals per liter and chloride 154 milli equals per liter. So together if you are adding these two, you will be getting 308 milliosmoles per liter. Okay, so these are all the two particles, that is sodium and chloride and water. These are all the particles present in the normal saline. And the next one is Ringer lactate. It is also an isotonic solution and its osmolarity is 273 milliosmoles per liter. So what are all the content present in the Ringer lactate? Water as usual, sodium, chloride, potassium, calcium, lactate, all these substances are present in the Ringer lactate. So if you are adding all these count, you will be getting what? 273 milliosmoles. So 308 and 273 milliosmoles, these are all the important golden points. You may get the questions related to this also. And the next one is, already I have mentioned about different anticoagulants which is present in the blood. These anticoagulant will prevent the blood from clotting. For example, these are all the golden points, guys. Additional points. Please make a note of these things. Last minute reading, you have to remember all these points. Okay. The first anticoagulant is citrate phosphate dextrose, in short CPD, and also it is also called as citrate phosphate dextrose. That is CP2D. 2 dextrose is there, that is called as what? CP2D. CP2D. So if you are adding this CP2D in blood, it will prevent the blood from clotting for 21 days. Okay, 21 days. Usually it will be added in the whole blood. Okay, and the next one is citrate phosphate dextrose adenine, CPDA1. Okay, so if you are adding this CPDA1, okay, so you can store the blood without any clotting for 35 days. So CPD if you are adding means 21 days. If you are adding CPDA1 means 35 days, it prevents the blood from clotting. Okay, and the last one is additive solutions. What is that? Here dextrose and adenine, these two combination is called as what? Additive solutions. Okay, so it is coming in the form of AS1, AS3, AS5. Okay, so if you are adding these kind of additive solutions, it prevents the clotting for how many days? 42 days. Okay, so these are all the things called as what? Anticoagulants. So 3 anticoagulants I have mentioned here: citrate phosphate dextrose, citrate phosphate dextrose adenine, and additive solutions. Please make a note of it. In short, here you can see CPD, CP2D 21 days, CPDA 35 days, additive solution like AS1, AS3, AS5 42 days, and temperature for storing the blood is between 4 to 6 degrees centigrade. All these points are additional golden points, guys. Okay, please write it in your last minute notebook, last minute revision notebook. Okay, you have to follow a separate notebook which should have the last minute vital points. In that notebook you supposed to add all these points also. Okay, so the next question is, The nurse receives 450 ml of whole blood bag with CPDA1 anticoagulant. So this question is also related to the previous one. So what they have mentioned here, CPDA1 anticoagulant from the blood bank. The nurse understands the shelf life of the blood bag with CPDA1 anticoagulant will be. Here they are asking the shelf life. What is shelf life? Shelf life means how many days it prevents the RBC from clotting. Okay, just now we have seen many things, that is, if you are using CPD, CP2D, 21 days it prevents the clotting. CPDA 35 days, additive 42 days. So here what they are asking, CPDA. So where is CPDA here? This one, second one. So around 35 days, right? So here which is the right answer? In this blood bag, what they have added? CPDA anticoagulant is added. So this blood, whole blood, can be stored without any clotting for how many days? 35 days. Okay, in case I am using only CPD, CP2D means 21 days will be the right answer. If in case if I am using the additives like AS1, AS3, so that time 42 days is the right answer. And for this question, which is the right answer? 35 days is the right answer. Identify the device. So what device is this? Many of the students given the answer, this is a infusion pump, this is a syringe pump. Okay, wrong guys. So here the exact answer is blood warming device. I will give you a scenario. Consider a patient is admitted in the hospital after a huge or severe trauma, severe hemorrhage is going on. So immediate blood transfusion has to be done. Continuous blood transfusion has to be done for the patient. So usually if you consider a normal patient means, if you are collecting the blood from the blood bag, we need to keep it for around 20 to 30 minutes in order to maintain the room temperature. Am I right? So after that only we will be starting the infusion. In this scenario is for a normal patient. But if the patient admitted in the hospital emergency ward with a severe hemorrhage, okay, so in that condition we should not wait for warming the blood for the room temperature. So in that situation, what we supposed to do? We should use the blood warming device. Okay, so blood warming device, it will warm the blood and it will infuse to the patient. Okay, fine. So this device is nothing but blood warming device. The next question is, Nurse Shilpa understand that the informed consent is based on dash ethical principle. See, many times this question is asked in the examination. Very, very important question. So here they are asking about the ethical principles. So first you should know how many ethical principles are there. So there are 7 ethical principles, like principles of justice, beneficence, maleficence, accountability, fidelity, that is keeping the promises, autonomy, veracity. Let's see one by one. Principle of justice means we have to treat all the patient equally. That's all. That is called as what? Principle of justice. Treating equally. Principle of beneficence means you have to do benefits to the patient. Okay, we have to do good deeds or good needs to the patient. And non-maleficence means we should not harm the patient. Accountability means we should have the responsibility to take care of the patient. Fidelity means keeping the promises. Autonomy means you should allow the patient to take the decision. That's why before doing any kind of procedure, we should inform each and every steps of the procedure to the patient. And we should get the informed consent signature, because it is up to the patient decision whether the patient has to undergo to this procedure or not, whether the patient can take the medication or not. Okay, it is up to them. We have given adequate freedom to the patient to take the decisions. Understand? So that is called as what? Autonomy. Autonomy means freedom. Okay, so if the patient is willing to admit themselves in the treatment, we can give treatment to them. If they are not willing, we cannot compel them to take the treatment. Understand? So that is called as what? Autonomy. Okay, and the last one is veracity, telling the truth to the patient. Okay, fine. So in this question what they are asking, the nurse Shilpa understand that the informed consent is based on. Informed consent, why we are giving to the patient? We have to explain each and everything to the patient. After that, the informed consent has to be get signed from the patient, right? Fine. So it shows the autonomy of the patient, decision making power of the patient. So here the right answer is what? Option D, that is autonomy. Okay, fine. And getting signature from the informed consent is from the doctor side. It is not the work of the nurse. Okay, so this point also you're supposed to keep in mind. The next one is the nurse identify the client response to actual and potential health problems during which step of the nursing process. Very, very important question. Many times they have asked this question is in the examination. Here what they are asking, the keyword here is actual and potential health problems during the nursing process. So in which nursing process, in which step of nursing process we are analyzing the actual and potential problems. See, while we are writing the nursing care plan, many times we have written the nursing process, that is assessment, diagnosis, goal or planning, intervention, implementation, evaluation. All these steps will be there in the nursing process, nursing care plan, right? Fine. So in assessment, what will be there? Subjective data and objective data. Subjective data, whatever the patient is explaining, whatever the problem the patient has, the patient will be explaining. Okay, so that is called as what? Subjective data. Yes, symptoms are coming under what? Subjective data. And objective data means what we are observing from the patient. We are taking vital signs and we are checking the temperature. Okay, so what we are observing, so that is coming under what? Objective data. Okay, and also the signs what we are observing, that is also coming under what? Objective data. So here what we are doing, we are just assessing the patient condition. Okay, and we are making a decision, that is called as what? Diagnosis. Okay, in the diagnosis, based upon the assessment, we are diagnosing the patient. A nursing diagnosis we are framing. Okay, so that is called as what? Actual or potential problem. Actual problem means what? What problem currently the patient is facing, that is called as what? Actual problem. Potential problem means the risk what the patient is going to get in the future, that is called as what? Potential problem. This is the difference between actual and potential. Very important point, guys. Actual means current problem, potential means the risk or the problem what they will be getting in the future. Okay, that is the difference between actual and potential problem. So these actual and potential health problems will be writing in the nursing diagnosis. So which is the right answer here? Option B, diagnosis is the right one. Okay, and the next one is identify the three components of problem focused nursing diagnosis statement. So here which is the key word? Three component of problems focused in nursing diagnosis treatment. If you take any kind of nursing diagnosis, you would have found a three component problem focused nursing diagnosis. So what is that three component of the problem focused nursing diagnosis? First you should have that knowledge. So here I have given an example, okay, where you can see imbalanced nutrition less than body requirement related to, here the keyword is related to. Okay, so this is the first part, nursing diagnosis. Okay, related to inability to absorb or metabolize the food, this is the second part, diagnosis, as evidenced by capillary fragility, decreased serum albumin, decreased serum transferrin or iron binding capacity, diarrhea or steatorrhea, whatever it is. That is the third problem statement. So how many problems are there in one nursing diagnosis? A problem and etiological factors and the symptoms or characteristics of the problem. Okay, so here you can see very clearly a nursing diagnosis, it is based upon three components. The first one is problem and second one is etiology, it is also called as risk factors, also called as related factors, and the last one is characteristics or signs and symptoms. Okay, and the problem or diagnostic label, it is connected with the etiology or related factors by related to. Here also we have seen the related to. Imbalanced nutrition less than body requirement related to inability to absorb or metabolize the food. So all these 2 points are connected with what? Related to. Same way here these 2 points are connected with what? Related to. The next one is the etiology or risk factors. It is connected to the characteristic signs and symptoms with the evidence. Okay, so here you can see inability to absorb or metabolize the food as evidenced by decreased iron binding capacity, diarrhea, steatorrhea. Okay, so here as evidenced by is there. So this is the one which is connecting the second and third component. Okay, so in this question what they are asking, identify the three components of the problem focused nursing diagnosis statement. They are asking the three components. Okay, so what are all the three components as per this one? Problem is present, etiology is present here, characteristic is also present here, and again diagnostic label, here also diagnostic label is present, risk factor is present, signs and symptoms is present. Okay, so these two are coming under what? Three components of problem focused nursing diagnosis. Underline the word problem focused nursing diagnosis, three components. So which is the right answer here? Option B, that is, sorry, this is actually option B, that is both A and B. Okay, so this is the right answer. And the next question is, you are educating a group of students about the ABO blood typing and compatibility. Which statement is incorrect? Many students are making mistake here. See, one thing you supposed to keep in mind before solving this question. A negative blood group people can receive blood from only the negative donors. But a positive blood group can receive blood from both positive as well as the negative donors. This is the first key point you supposed to remember. Okay, and second key point is you should know about the antigen and antibody. Consider this is the RBC. A RBC will be containing what? Antigen. It contains what? Antigen. Okay, for a positive blood group people, two antigens will be present. How many antigen? Two antigen. The first antigen is either A antigen or B antigen. Okay, and the second antigen is RH antigen. So RH antigen and one more antigen. Two antigen will be present for the positive blood group people. Once again I am repeating, consider this is the RBC. RBC is having what? Antigen. Based upon the antigen only we are fixing this person is having A blood group, B blood group. Okay, consider this is the RBC. Okay, and the RBC is having two antigens for the positive blood group people. Which blood group people? Positive blood group people. Consider this is the patient who is having A positive blood group. Okay, so A positive is one antigen and RH antigen will also present for this patient. So RH and A positive, these two antigens will be present for the positive blood group peoples, whereas for negative blood group people, again this is the RBC, only one antigen will be present, either A antigen or B antigen or AB antigen. Okay, so either one antigen will be present. For positive, two antigens will be present, and for negative blood group peoples only one antigens will be present. So this is the second key point what you supposed to remember. Let's move on to the question. You are educating a group of students about the ABO blood typing and compatibility. Which statement is incorrect? So they are asking incorrect. Okay, so ABO blood typing and compatibility and incorrect. So these are all the keywords you supposed to remember before solving the question. So here let's see the option one by one. A person with B negative blood can donate blood to people with either B negative or AB negative. Yes, obviously it is right, because B negative blood group or donor can donate blood to what? Either B negative or AB negative. This is right. And the second option is the person with B negative blood can receive blood to donor either from O negative or B negative. Yes, obviously this is also right. A B negative receiver can receive blood from the donor like O negative and B negative. Yes, obviously this is right. And option C is a person with O negative blood can donate to every blood type regardless of RH factor. Yes, because O negative is a universal donor. Okay, many students are making mistake here. They know O blood group is a universal donor, but positive or negative, still they are having the confusion. See, please remember O negative is the universal donor. They can donate to anyone. Okay, but O negative can receive blood only from the O negative people. Okay, that also you're supposed to remember. Okay, so O negative is a universal donor. And so option C is also right. Option D, a person with AB positive can only donate to either AB positive or AB negative. So this is the wrong answer. AB positive person can donate blood to AB positive or A positive or B positive, but not AB negative. Okay, so this is the wrong answer. That's why we selected option D as a wrong answer. And blood type compatibility, this is for last minute reading. Just make a screenshot and please read about this one. Okay, blood type, whom they can give and from whom they can receive the blood, all those details are present here. Okay, so this during last minute reading or revision you're supposed to read all these things. The next question is, which of the following makes the nurse alert that a patient has a greatest risk of aspiration during the meals? It is a very easy and simple question, but still you need to think a little. And here they have given 4 options. Before seeing the option, let's see the keyword here. Which is the keyword? The greatest risk of aspiration during meals. Okay, so which patient will be having greatest risk of aspiration among these 4 options? Bulimia nervosa. Bulimia nervosa means what? Binge eating will be there. They will be eating more and more food, and purge will be there. Purge means inducing the vomiting. If you see the nails of these people, the nails will be fully damaged because of induced vomiting. Okay, so these are all the keywords related to bulimia nervosa, and bulimia nervosa will not cause any kind of aspiration. And the next one is lethargy. See, obviously we have to think about what lethargy, because during lethargy the patient will be not that much means energetic, or the patient will be semi-conscious. So there is a chance for what? Aspiration. So we can consider the option B. What about anorexia nervosa? Anorexia, C-A-N-O. No means they are saying no to the food. This is how you're supposed to remember. Anorexia, they will not take any food. Okay, so anorexia nervosa. So here also there is no chance for what? Aspiration. And stomatitis means inflammation of the mucous membrane of the oral cavity. So here there is a chances of aspiration because of inflammation of the oral cavity. But still we need to go with the priority, right? But based upon the priority, we are selected the option B, that is lethargy, as a right one. The last question is, which of the following is the high flow oxygen device? Yes, this is not the last question. Few more questions are also there. Which of the following is the high flow oxygen device? See, you supposed to remember 2 things. High flow is different, high concentration is different. Here many students are making the mistake. High flow in the sense you have to think about what? Here you can see Venturi mask, CPAP, BiPAP. All these things are coming under what? High flow devices. High concentration is totally different, guys. We will be discussing about that later. Okay, so here the keyword is high flow device, high flow oxygen device, and they have given 4 options, that is non-breathable mask, nasal prongs, simple face mask, and Venturi mask. So all these 3 things are coming under what? Low flow oxygen device. And here the right answer is what? Venturi mask. Venturi mask is coming under high flow oxygen device. Here in this you can see very clearly low flow oxygen device like simple face mask, non-rebreathable mask, partial rebreathable mask, nasal prong. All these things are coming under what? Low flow oxygen delivery device. And high flow is Venturi, high flow nasal cannula, CPAP and BiPAP. Okay, please remember this. So these are all the images. So this is the simple face mask. Nasal cannula, especially it is very much useful for what? Which patient? COPD patient. Mostly we will be administering what? 2 liters of oxygen to the patient, not more than that. Okay, fine. And this is the one called as Venturi mask. And nowadays the advanced Venturi mask is totally different. There is no color coded at all. Previously the Venturi mask will be having different color codes, and different color codes will be giving different percentage or liters of oxygen to the patient. Okay, accurately it is giving the flow of oxygen to the patient. But nowadays this kind of Venturi mask is not at all used in the specialty hospitals. Only one Venturi mask will be there, and only one color code will be there. In one Venturi mask it is having a adjustment type. Okay, easily we can adjust the different flow rates and we can deliver the accurate oxygen to the patient. Okay, fine. And the next one is, here you can see rebreathable mask and non-rebreathable mask. Related to this, many times they have asked questions. Okay, so rebreathable mask, non-rebreathable mask, what is the difference between these two things? Here this first image is rebreathable. In rebreathable, there will be a mixture of gas will be present, that is oxygen plus carbon dioxide. Mixture of gas will be present in the rebreathable mask. Understand, guys? Fine. And non-rebreathable mask, it will be having only one way valve. See, two-thirds of the oxygen will be filled in the reservoir. This bag is called as what? Reservoir bag. Two-thirds of the oxygen will be filled in the reservoir bag and the oxygen will be going towards the patient. That's all. There is no mixing of the air. Okay, that's why it is having what? Only one way valve. Okay, guys, so this one is giving more concentration of oxygen to the patient. Okay, non-rebreathable mask gives more oxygen concentration to the patient. Understand? Underline the word, underline the key point, more oxygen concentration. Okay, I think around 6 liters of oxygen is delivered to the patient. Around 96% of or 96% concentration of oxygen is delivered to the patient. Okay, fine. So nowadays this non-rebreathable mask is more commonly used when compared to rebreathable mask. Okay, so all the points whatever I have mentioned here is the key points, golden points. Okay, so please make a note of it. And yes, guys, so this is all about the questions. So if you have any doubt anywhere related to this video, please make a comments in the comment section. So thank you very much. Let's see in the next video. And if you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. Okay, so share this video as much as possible so that everyone will get benefited from this. Okay, thank you very much, guys.